glasses off for me?
I can take the mask on since you do it that way.
That a boy.
By the way, I got 3 COVID tests this week and passed every one.
Damn! You're like a Sharpay, dude.
Wait that's what kind of bedside manner is that? That's that wrinkly dog.
That's when you have your best buddy come see you.
That's what he's referring to.
Well,
what type of bedside manner is that?
You're animating very, very well. You want some anesthesia? Here it comes. I'll take care of you, brother.
So for the handful of people who've been living on Mars who don't know, Dr. Drew Ordon, who's an plastic surgeon extraordinaire, many other credentials, ear, nose, and throat. Also the host of Emmy Award winning,
and we're having this great discussion today. Just this week, we taped our 2000th anniversary show
of the Doctors.
The Doctors.
Yeah.
And for daytime TV, I didn't know TV when I got into this. And, I heard Dr. Phil when we first started, he had 1,000 shows.
1,000 episodes, yeah.
Lo and behold, we beat all the odds. Everybody said it's not going to happen. I mean, Jay McGraw, the executive producer, he said, guys, it's 1 year. We'll see if we make it. We make it. But 13 years was a pretty good run. But seeing all those clips of just the camaraderie, the people that we helped, people that we got to quit smoking, to lose 200 pounds, to do a self-breast exam, and they end up finding something that saved their lives. And then for me, as the plastic surgeon, reminisced on going to Haiti and treating the kid who literally a roof fell on his head, and I reconstructed his skull and his forehead. I also did some burn care in Haiti. Smile Train I did through the doctors, going to India. That was awesome. And I hadn't really thought of all these things, but when you have that many episodes and they're putting it all together as a collage like that, it really...
Well, and what's cool is I remember you and I were speaking about this just a few years ago. It was the first time it came up, and I said, how did you end up on the Doctors? Because I knew that you were a doctor first, and you told me about this story that you were out, I think, practicing, doctoring in Palm Springs, and you just got a call, but you were not an actor, you were not a TV show.
No, and I had done my share of talk shows, back in the day. I don't know if you remember Sally Jesse Raphael and Maury Povich, that show.
But you're a medically trained doctor first.
Absolutely.
So, your background is medical.
When the McGraws were casting this, they wanted working, practicing physicians in the trenches.
Yeah. So that's my point, because look, we're obviously in the TV world and been doing commercials for years. And I got to be honest, we get dozens, if not hundreds of resumes a year from doctors. People who've been to medical school. Yeah. And honestly, I would not let them put a Band-Aid on my chihuahua. Not that I have a chihuahua. But literally, and these people are pitchmen.
Well, and they're trying to sell their books or their products, right.
And the difference is that you are a practicing, 9 out of 10 times if I text or call you, unless it's like to go to a World Series baseball game or something, you are either in surgery, prepping for surgery, meeting post-surgeon patients. You are, again, I don't think that people always make this connection. They see you on TV. I think they'd be surprised to be like, this guy is doing surgery.
Well, I want to send that message that I want it crystal clear that I am still practicing and I still have a passion for it. And, I think that people see me do my work on TV, but they may wonder how much time I actually give to the office. And I want that crystal clear. Yeah. I'm still practicing with no end in sight. But getting back to how it started, my audition with Phil McGraw and his son Jay, it took place in his house in Beverly Hills. And, it was more of a discussion. I had known them from Brentwood School where my kids went. But Jay brought it up. He goes, my brother, Jordan, told a story of there was a big party at Brentwood School and all of the bros were together. They were out late. They had a few pops. Their friend Santi, who I love like a brother, he gets a little liquor in him and he can be a little wild. So somebody cold cocked him I mean, his nose was on the other side of his face. So this is 3 a.m. So the whole group came over to my house, got me out of bed. I come downstairs in my pajamas, and he was already had enough to drink that he was feeling no pain. So the anesthesia was there, and I literally did a closed reduction on his nose in my living room, and Jordan McGraw was there and observed that. So he went back to Jay and said, Jay, this is your guy. I mean, I saw him do some crazy stuff.
So you realize after this now, anyone who gets in a bar fight at 3 a.m. is going to be like using their one, let's just call it.
For you, I'll answer the phone.
You guys have been watching the doctors over the years and everything. People are fascinated with these TV shows and programs where you have real, legitimate doctors talking about everyday experience.
And we talked about that on Monday, that I think we truly did entertain. We sent a message. We helped people, but we did it in a fun way. I mean, laughing. They asked me my most memorable moments. You can imagine talking plastic surgery with Joan Rivers, and she. That woman is one of the smart. I don't know if she went to Vassar or Radcliffe, but this is one smart lady. Her dad was a doctor. Loves her plastic surgery, was never shy to talk about her plastic surgery. But the interaction that I had with her was, I will never forget it. I remember one scene, I was doing fillers in the décolleté area, sun damage, so there were some lines. So
that's the chest, and the décolleté for those like myself who wouldn't have known
Thank you.
That.
So Joan Rivers was my assistant. She had the gloves on.
Oh my God!
I have the syringe, and she's standing behind me and like patting me as if we're in surgery, sweating. But just the stuff that she was saying. She grabs the pig, goes, "Do you have a fella?" She goes, "Well, you will after this." I mean, just brilliant comic.
What do you think when you see someone like, you brought up as an example, like a Joan Rivers, or someone who I guess would be widely considered to the public as really having overdone it, gone too far? And again, maybe she's happy or not, but isn't that kind of the opposite message that generally you're about precision, you're about natural?
Well, I mean, that's the key. My slogan is plastic surgery that doesn't leave you looking plastic. But you have to understand that Joan Rivers came up in a whole different area. She had an old school nose job, the typical. It was cookbook, pinch the tip, scoop it out a little bit, turn it up. I mean, everyone got the same nose job, and it's different now. We tailor the nose to the face. Yeah, she was pulled more than once, maybe too many times, but in person, I must say, yeah, she looked done. But she looked pretty darn good.
You never did any work on her. You were not her.
We talked about it. She wanted me to fix her bat wings, and I examined her on the show. And she and I became friends. She invited me to some of her stand-up comic acts in the Village, where she practiced them before she went on the road to Vegas, Atlantic City, whatever. But she invited me to one of those, and she was this guy. I think she scheduled, and then she had to cancel, etc. I never did, but I consulted.
But what's interesting is how you talk about, like under here, you reference the bat wings, and it is so common. I mean, in everyday life, like we know what the bat wings are because we had a fitness product or a personal care product years ago that we marketed for the bat wings, which was the underarm or some. So it's interesting how we have terms for non-clinical terms that come to you, like people
like saddlebags and love handles.
Right. But as long as you're saying that about yourself comfortably and not taking yourself too seriously, that's why personally I like seeing that people are much more comfortable and confident saying openly, like if they want to have something done, I think great, then do it. And if you don't want to have something done, great, don't do it and feel great about yourself either way. But I do think that the stigma of, you're just trying to look younger. Well, of course. Who the hell doesn't want to look younger?
We all want to look our best, And as long as you do it, for the right reasons in a reasonable way. You're 65. Don't come in and tell me you want to look 25. That ain't going to happen.
Right. Yep.
Huge trend now in plastic surgery in our office is removing breast implants. And women who had them done before, they're not feeling comfortable. There's this whole issue of breast implant illness that, at first, most of us plastic surgeons poo-pooed it, but nothing is 100%. So if you put a foreign body of any kind into somebody's, there's going to be a group of people that aren't going to do well with that. And, I think women are smart. They follow this. And if there's something not quite right with their bodies, they're feeling, I'm a little bit off. Maybe removing my breast implants will make me feel better. So we're doing a lot of those. Removing breast implants, most cases doing a lift, and then using your own fat to augment the breast. You can't get the same result as a big implant, but use some of your own fat, all natural. A lot of women are doing that option.
Well, wasn't that the product specific related, that there were some products, some implant products that leaked or had health issues, or are you saying that you have a concern?
I mean, there were the older implants leaked, capsular contracture where it got firm. There may have been free silicone. So, you want to remove that because your body is mounting a chronic response to that. So for a lot of people, that may be the best option to remove it. There was a textured type of implant that we find that was associated with a specific type of rare cancer, not a breast cancer, but a lymphoma, anaplastic large cell lymphoma that was associated. So the women that got those implants, they definitely want them out.
What do you guys have opinions on?
I'm pro do whatever you want. If you are uncomfortable with your body, I wish that you wouldn't be. And if it would make you feel better to change your body, then change your body.
And that's where plastic surgery is great. Doing it for the right reasons. If there is some characteristic, you're flat, and I'd rather not be flat. I would feel better in clothes, out of clothes, in a bathing suit, whatever. Great idea. Right. But if you're insecure about other reasons and you think that breast implants or anything else for that matter is the solution, you're probably doing it for the wrong reason.
Well, you had a breast reduction, didn't you?
Moving on. But I've been very...
That's a great, man boobs.
Boobs all the time.
Man boobs.
Yeah.
We talk about women and their insecurities. Let me tell you, when you get one of these man boob cases, especially in a teenage kid.
For sure.
He doesn't want to take his shirt off. He doesn't want to go to the beach. He doesn't want to be seen in the locker room.
It's a real condition that happens pretty common, more than people think.
Yes,
you wouldn't see it because these guys aren't taking their shirts off.
I had a friend who would wear multiple shirts under a shirt.
There you go. It's sad.
It's sad.
What's the technical term for that? I forgot.
Gynecomastia.
Gynecomastia,
which is enlarged breast tissue in a man.
Right. And sometimes that happens too with like bodybuilders who are doing steroids, right? Or something similar to that where they...
Yes, that you get, depending on the steroids, you can get like an estrogen effect, which does promote the growth of breast tissue.
But you're able to do procedures on
it's like a simple mastectomy. You preserve the nipple. Typically, we do a combination of liposuction and an incision around the nipple with sharp dissection, because typically there's a little pocket, a little nubbin. Life changer.
Yeah.
Life changer.
So I went to Sono Bello.
Nice. Which we know well.
So Dr. Ordon is the spokesperson doctor of Sono Bello, which is one of the premier liposuction centers across the country. As a matter of disclosure, we do a lot of the marketing and advertising for them.
And you brought that project to me, and I did my due diligence. I know a number of board certified plastic surgeons that work for Sono Bello.
Yeah.
Here in LA and in New York. In fact, two of them were my co-residents. Yeah. So we trained together. So I got in line with them, and I wanted more information before I was willing to put my name on the line.
And I remember I said to you at one point, I said, so what is the difference between going to Sono Bello for liposuction versus going to someone in Beverly Hills or Park Avenue and doing liposuction in certain areas? And you said about $40,000 less, but not much else. It's pretty great results. And you said, I love how honest you are.
And that was their business concept, that they were, since they only do liposuction, they do a couple other little nips and tucks, but really focus on liposuction, which is their model, and they've brought in good doctors. They have the technique down. They use a certain laser assisted type liposuction technique. They've got it down. It works. For that reason, how they do it, they're able to keep costs down.
Yeah, and quality and service, and it's been so much so that
You're happy.
I'm so happy.
Really?
So happy.
Good for you.
Yeah. So this is my before
have you
and
seen these,
after.
Doc?
Whoa!
Now this actually was, what was this, my 3-month? I mean, pretty dramatic. So this
Pretty
is, I've had 2 kids. You know, obviously things have changed a bit down there.
And this is a result without a tummy tuck. They didn't remove any skin.
This is their equivalent of a tummy tuck, which is less invasive, as you know. So I did get the skin removal.
But
Yeah.
down low only.
Down
Okay.
low only.
Just goes to show what we're doing now with body sculpting, especially in the abdomen, that it's 3-dimensional liposculpture. You can see that we don't just draw a thing, oh, we're going to remove centrally. You want to create concavity on either side of the rectus muscles, and you want to leave the superficial layer of fat over the rectus to make it look like you have defined abdominal muscles. So the way I learned lipo 30-something years ago, the way we do it now is light years away, and this result demonstrates
And this
that.
was one visit.
One visit.
Yeah. And what did you do?
I went in on a Friday and I was back to work on Monday. I know that's
He
not
made you come
normal
into
for
work
all
Monday,
people.
didn't he?
Yeah.
He goes, yeah, you can do it as long as you're here Monday.
In fairness,
we know how you roll.
But we also let her take Saturday and Sunday off that week. So I mean, let's tell the full story. But so you did your tummy, and then you said, did you do your? What else did you do?
I did my chin too, my jowl.
I remember when you posted these pictures, what I loved is that every single person was so supportive and sweet,
Yeah.
no trolls, just everyone. Because
sure.
like you
No
said,
haters.
no, but like you said, first of all, no one knows more than we do here how hard you work.
Mm-hmm.
You have 2 kids, you know, you work a ton, beyond belief. You have a great husband who's a cop, so your family life is just absolutely nonstop. So for you to want to do something for yourself and to be, you know, very happy and comfortable, and it was so nice to see the support that you got because you deserve it. You know, I'm sure you would love to spend 3 hours a day in the gym, but you're taking care of your kids and coming to work.
Here's the thing too, I do want to say I eat healthy. I work out with a trainer. Before gyms closed down, I was going all the time to the gym. So this isn't like just someone who's lazy, like just eating whatever they want. I really was trying very hard to do it the natural way, but this Sonobello really just it's a kickstart, right? To
Now,
getting back.
And the thing I have to remind everyone too, I'm just realizing, is that so it's not confusing, whereas Dr. Ordon is the brand ambassador for Sonobello and endorses it, and you'll see him in the commercials and often on the website. If you call Sonobello to book an appointment, Dr. Ordon will not be your surgeon. So that we don't, they have doctors and centers all across the country, but Dr. Ordon has his own.
But if you're compelled,
practice.
you can find me.
Yes, if you're compelled, you can find him at his own private practice in Beverly Hills. Or if you're ever driving to Palm Springs or Palm Desert, you can't miss him because his beautiful mug is on the side of a big billboard on the side of the road, welcoming you to Palm Springs and encouraging you to go get a procedure with Dr. Ordon or Dr. Chopra, his partner.
You know, for some reason, the sound of a billboard, a little sketchy, but there it works. I mean, in that community, for whatever reason, and you have a lot of people coming in and out, and it kind of plants the seed. Maybe come here for something.
So you and I know you said it's okay that we share this. You've been open about it. You had COVID way back in
early on. This was end of January. I did a TED talk
before
in
people knew
state
there
of
was a
Washington, and as you know, state of Washington was one of the hotbeds, and so. We didn't even know what COVID was then. I went to this convention up close and personal, shaking hands, not washing my hands, no masks. And COVID was out in the community in the Seattle area. So did this thing and winding down the meeting, heading towards the airport. And you've had that where you go, darn, I'm coming down with something. So it felt like the flu was coming on. So achy, malaise, headache. I think I may have had a little bit of an earache too. So I'm like, I think I'm coming. So get on the plane, go home. Told my wife, hey, I'm sick. I think I'm going to stay away from you.
You told me you thought you had the flu because
I did.
We were going to film something, and you're like, Drewski, I think I got the flu. I was at this thing.
And I want to stay away. So I went to the desert and isolated myself.
Yep.
But it's then that the other symptoms clicked in. So it was the sore throat, achiness, just feeling run down. But it's when that cough set in, and it was a very unique cough, a cough like I'd never had. I'm not asthmatic. I don't cough much at all. But this cough was different than anything I'd had. It was like a deep-seated... and once you started coughing, it was hard to stop. Yeah. And that lasted for a few days. Then you had that post-inflammatory reactive cough. That lasted another week or so. Yeah. And then I got better.
But I remember speaking to you, and what you thought was, because again, this was January, early February, and really we did not, well, first of all, we weren't using the word pandemic even in March. It was still arguing whether people are really getting sick or not. I mean, back and forth. But I would go say back in January, 99% of all Americans didn't even know what COVID was. So you thought at the time that you had a really bad flu. And you're like, it's a flu, but it's a little different flu, but and you got over it. And this is the part that blew me away. Not that you could have known any different, but in March, and there's a reason you didn't get a COVID test at the time. One, they didn't exist, and two, nobody really knew what COVID was. It was but you had a special guest on the Doctors
sure did.
In March, and I mean, this is like a scene. Remember the movie Airplane, where there's this classic film, and all of a sudden, like two people are having a conversation, a doctor and someone else, and then the pilot is realizing like he kind of had the symptoms and is reacting. And you're telling me this story about when you became crystal clear what you had. Who was your guest on the Doctor?
Well, it was Tony Fauci, and I have to say,
Dr. Fauci is
Dr. Fauci. He was on the show twice, in fact. What a class act.
And this is
what
March.
A good guy. This was March. And then just some of these pieces were starting to come together. And then when I heard him give his spiel, I went, uh-oh. Yeah. And we talked about it starting in Washington and all those things and what I went through.
And by then, you're probably like this. He's talking, you get a fever. You're like...
Wait, so this is March, so you were already healed by this point?
Yes.
Okay, so you were already...
But I knew that I went through something that was a little bit different.
Gotcha.
So, but then he reinforced all that with the symptoms and stuff. So subsequently, that's March, April, I got my antibody test. And yes, in fact, I did have the circulating antibodies consistent with having had the infection earlier on.
So you may be one of the only people in the world who can actually say that you found out from Dr. Fauci that you'd had COVID. Essentially.
Pretty much. Dr. Fauci sort of did confirm my diagnosis in my own mind. Yeah. And then, what remains to be seen, I got those antibodies and I'm positive, knock on wood, I hope I'm immune. Yeah. Just for other reasons, traveling, the hospital things. I've had probably half a dozen COVID tests since then, all negative.
We all got tested again yesterday here at the office. We had the whole office tested yesterday.
You have to.
We got tested. Friday will be my third COVID test just of this week for a lot of my own traveling and shooting, filming reasons. But you have to do it. Yeah. You got to keep everyone safe. That's why we're comfortable around here. We have the air purifiers. We have a very limited significant criteria for anyone who can even come in the door here to keep it safe for everyone.
We almost didn't let you in.
Yeah. But then we figured if we got sick, we needed you. When you talk about travel, one of the interesting things in your travel schedule is you travel very often to Dubai. And not you were, and not just sightseeing. And again, you travel quite well when you roll there. And who's bringing you down when you do that? What's the deal? Like
it's a group. It's tied into the royal family of Dubai. They were involved in our clinic. The Valiant Clinic was our host. It's the Beverly Hills Sunset Surgery Clinic International. in Dubai, but we partnered up with the royal family in Dubai. They were our partners of sort in this clinic.
And how often? So
I was going like every 6 weeks.
Yeah.
I mean, this was a good gig. I was brought on early on as the chief medical officer, sort of the face of the thing. Notoriety from the doctor show in the Middle East airs. People like it. So for that reason, it made sense for me to go. And then my last trip was beginning of March, and then
they cut off the travel.
That's when.
Yeah, but you've treated members of the royal family over there.
Yes, and from Saudi too. And
and Saudi Arabia as well.
Yeah.
So which crown prince has had a nose job? You can tell us.
I can't say, but they love their plastic surgery over there
in Saudi Arabia.
Just in the Middle East.
Yeah.
The women want to feel good about themselves. They want to look good. They want somewhat of an exotic, over the top look. So these stylized noses, big lips.
Now, is that surprising? Because to me, that when he used to say that, honestly, for the first couple of years, I thought he was making it up. Many of the women are covered. You have laws where women in some areas can't drive. There's
a time when everybody gets uncovered, right? And that's part of the deal, that they want to look their best. And that the Kardashian look was big. And Bella Hadid, that look, that Middle Eastern. Yeah. And they have a Middle Eastern background, though, that group of people.
So did you have a chart where it would say, did you want a Bella or a Kim K?
I've had a lot of requests for that Bella nose.
Really?
Oh, yeah. Obviously, they want that tiny, tiny sculpted waistline.
I used to work at like Sephora and Ulta, and those were our biggest spenders. They would spend a lot of money on cosmetics, sunglasses, accessories, because they care about how they look.
Here in Los Angeles, huge Persian population. That's all the same neck of the woods. I think they do more nose jobs today in Iran than per capita than any place in the world. That you walk down the street in Tehran, I haven't been, I've seen pictures, everybody has tape on their nose, and they don't mind showing it.
Going back to COVID, you're fully recovered. You didn't have any of the long haul things that people talk about that scare the crap out of them.
No, losing your smell and your taste, no, or any recurrent issues, no. And that, for some people, that cough can put you in a chronic state where you have respiratory problems, almost like asthma, but I didn't have any of that. No, I'm feeling good and working out and fit.
I know that one of the things you became super passionate about earlier than most, because you had COVID before we even knew it was COVID, is you became, I don't want to say fanatical, but it's a good thing in this case, but very, very, very passionate about immunity, boosting up your own immunity. And one of the things that you're heavily involved with right now is a product called Resistance C.
And I love it.
Yeah.
It's always been a little controversial in the medical field, and Dr. Travis and I would butt heads.
Over vitamin C?
Over vitamin C. And I said, Travis, sure, you can get it in your diet, but why not, if you know that something is so important for so many physiologic bodily functions that are important, immunity, growth, repair are three of the biggest, why wouldn't you give it a little extra help? And I, talking about traveling, I would make sure that I was getting those things that we now have ultimately put in our Resistance C product. And I'm talking about vitamin C and the zinc and the vitamin D, that whole cocktail to boost your immunity, I think help with your sleep patterns, help with jet lag. You get off the plane, you got to go to work. Yeah. I think vitamin C gives you a little boost too in terms of energy.
So I think the thing that's interesting too is that most of us, I get up in the morning now and I have this bag of pills that, not even the fun ones like back in college, but the ones that my doctor makes me take just to keep, existing in this world. And you get tired of so many pills and stuff. And what was cool, one of the things that got us excited about working with you on Resistance C and our partners on that was that it's a drink. and it's something that you're going to have a drink of water, you're going to have a drink. It was so easy. It was so intuitive. And I want to be clear too, because you're always clear about this. Nobody is saying that taking an immunity beverage, no matter how much vitamin C, is a cure or is going guaranteed to prevent COVID. We're not tying COVID to any specific product by any means. But as a medical doctor, I imagine, like most, the first line of defense is building your own immunity.
Well, yeah, and we know how the immune system works and how our lymphocytes, our white blood cells, how they all work, and they need vitamin C, and they need vitamin D, and they need zinc just in their normal metabolism. So
Speaking of zinc, so I just read an article that people who have been hospitalized with COVID symptoms were more likely to be deficient in zinc. I like that you're not just going to the store and like taking only vitamin C where that has zinc in it. It's almost like you're ahead of the curve of what your body needs.
So that's what they're finding with COVID, that it's not just the effect of the virus itself, but it's the effect on your immune system that's sort of like a secondary. It happens in certain people. We're not 100% sure why that is, but that makes sense.
That's why I don't buy it when people say, I mean, you mentioned someone that you know from your show is not so huge on vitamin C. It's fine. People are entitled to their opinions. But when people are like anti-supplementation or and I agree it has to be the right products. There's a lot of snake oil out there. There's no doubt. But the idea that, you can get all of what you need just by eating a normal diet, I think that's absurd. And it's just simply...
Does everyone eat a normal diet?
Correct. Number one.
No.
And number two, who knows what each person is eating? If the four of us right now line listed even what we ate yesterday, even if we all ate a healthy, well-balanced diet, which we probably generally did because I'm familiar with all four of us. We've been friends for years. We've had meals together. So minus, a few different things, I'm sure we all ate relatively consistently. But is there any reason to believe that Adrian got enough vitamin D in her meal choices and Dana got enough zinc and you got enough? It's absurd. And so
and you can only eat so much arugula and kale, right?
And yet,
I mean, the show has got me on this stuff. I'm eating stuff that I didn't even know what arugula was 12 years ago, and kale, and now it's a regular part of my diet. Throw some.
But the people who will sit there all day long and pop 17 prescription pills, for any reason. You got people in West Virginia who are prescribing 300 or 3,000 OxyContin for every single man, woman, and child, so that the Purdue pharmaceutical conglomerate can make billions. But that's okay because it was written by a pharmaceutical. But don't buy a supplement in Whole Foods, or don't buy a supplement online in Amazon because that's all snake. You got to be kidding me. Of course we need supplements. Of course we need nutritional and vitamins and minerals, and we need it more than ever right now. So I think that's, I was happy to see that you were excited about being in that space and the position you've been taking, speaking out and researching.
100%.
And vitamin D, I know you mentioned, has been having a lot of positive news lately. What's the big deal with vitamin D? Why it's so much in the news lately?
Well, that for so many people that they just don't have enough on board. We know how important it is for good bone health, for good musculoskeletal health, for good heart health. Women have more osteoporosis, strong bones. Women, as they age, don't absorb vitamin D as well. So, vitamin E is crucial for so many things, including immunity. And unfortunately, we don't produce our own vitamin D. And I think there's more people in the population than we think that are not absorbing enough vitamin D in their diet. And I'm not suggesting that it's placebo effect but you can't deny the placebo effect is as effective in many people as taking whatever. If you really believe that this is going to help me. I mean, my wife, as long as I've known her, she swears by taking vitamin C when she feels like she's getting sick. Obviously, now we're all really hyper-focused on our immune systems.
Right. We need to be.
It's every immune for
Resistance
themselves.
C is part of my daily routine.
So what's the best line of defense to sort of prep for this season?
Make sure you get your flu shot. Make sure that you're doing all those things that we talked about for COVID. We've talked about how do you prevent the flu for the last 12 years on the doctors. That's always a big thing. We have a special flu season show every year, and it's doing all of the same. So it's hand washing. It's trying not to be in close contact. So the social distancing is so important. Distancing. If you're sick, make sure that you stay away from other people so you don't spread it. Wearing the mask is important. Eating right, making sure that you get enough sleep, and supplements are a good thing too.
Supplements, for sure. One of the things that we've been seeing regularly, and you were talking about it, business for you has not been bad at all in COVID, has it? You know, I know you're not.
Well,
happy
a couple
about
of things
COVID,
going on there. Number one, we had a moratorium, so we couldn't do things. So,
but
there was a time when we had to put things that were scheduled on hold.
Right.
And then,
but now that you're allowed,
hey, people weren't getting their fillers and their Botox, and they're not.
But now that you're allowed to practice,
they were getting hairy in the wrong places and all those things.
Another great example. Thank you, Doctor.
Well, we do a fair amount of laser hair removal, so that's just.
Why are you looking at me? When you say that,
I'm just saying that these are the sort of the go-to things that people regularly would come in for maintenance. So they fell behind on that. So as the moratorium lifted, we saw a big boom on that. But something else that's going on is what we call the Zoom boom, that people are producing their own stuff. They are on TV, or just talking to friends, conducting business. They are looking at themselves real time on their screens, and sometimes they don't see what they like, whether it be those wrinkles
Zoom
or
boom.
those
I love
lines.
that. Yeah.
And the other thing is, think about it, everybody's wearing masks. It's a perfect time
So you see
to
this.
do something
Yeah.
on your face.
Yeah.
Nobody knows. Your nose is covered,
Right.
your lips are covered.
You're saying Botox and filler is a big deal. That's a top one. And the best thing about having a friend who is a renowned plastic surgeon, among other things, your medical background precedes you, is when you want to get a little free Botox and filler, you say, Dr. Ordon, you want to come down?
Ladies, is this why I'm here? Is this why I'm here? Have I been sucked in?
And it said, come on down. We'll do a podcast. We'll catch up. We'll show you a few new products. Forgot to bring them today. Next time. And hey, bring some of that Botox and filler with you while you're there. And look, we have some lights to set up.
Does this make him a friend with benefits?
A friend with benefits.
He did say that.
He brought his gear, and he's going to. Let's see. Do we have a volunteer in the audience? Okay.
Oh wait.
Anybody who is looking for a little Botox and maybe a little filler?
I'm fine. I'll do it if it helps the
Wait,
podcast.
can we hear why you want to do this? The real truth. And let's be honest, this isn't just for podcasts.
It's because you two make fun of me.
No.
Because you're very mean.
Look at his forehead right now.
But I don't make fun of you,
He's
right?
animated.
He's making
We would never make fun of you.
He called me a Sharpay when he walked in before.
Damn, you're like a Sharpay, dude.
Like, who does that? What type of doctor does that?
That's a technical term.
That was a TV moment, but I mean, you're animated, and you're just like we said, the Zoom boom. You're seeing yourself on the screen more than ever, and you see you're animated, which is great. We don't want to stop the movement of your face, but softening your forehead, taking out those lines, softening your frown lines will make you look younger.
But wait, you never answered my question.
The question was
Why do you want to do this?
because we brought a potential client in a few months ago or a month ago, and you and I got in a betting game over what his age was.
Yeah.
And I thought he was probably a lot older, and you thought he was probably a lot younger. And then ultimately, for whatever reason, you asked this individual to guess my age.
He guessed accurate, and that's a problem.
Right. And we turned down his business and told him to get the hell out.
He did guess accurately. Yeah.
We said,
And
"Your
then
money's
we
no
asked
good
him,
here."
why do you think that? And he
Instantly,
said,
he's like, well, look at your forehead, man.
Your
forehead's
wrinkles.
like
Yeah.
aging
So a
you.
couple questions. Have you ever had Botox or fillers?
I have. Yeah, I haven't
Okay.
done it in probably at least a year or two. And the reason why is, one, it does get pricey after a while when, your prices.
Because you do have to maintain it. So let's talk about Botox. We're going to do it today for you. It does take 24 to 48 hours to set in.
And we took a before picture, so we have
Good. And you know what? We use it for wrinkles that come with animation when we use our face. Primarily, main areas, and this is what we're going to treat for you today, are going to be the forehead wrinkles, frown line, crow's feet. So when you smile,
right. That's what the Botox.
That's what the Botox is going to do. What does it do? It blocks where the nerve comes into a muscle to cause it to contract. So what you're doing is just slowing down the action of the muscle, which in turn will reduce the appearance of wrinkles. And then 2, aging, we know the formation of lines. We also lose volume with aging. So I brought a little putty with me, a little Bondo that we're going to use to add some volume back to.
Bondo doesn't sound like a medical term now.
No, we're using Juvederm Ultra Plus
filler
XC for you.
And then I wanted to ask, 6 months from now, are you available to do another podcast? We have the calendar out randomly. There's another topic that we wanted to discuss.
And then with fillers, these are hyaluronic acid fillers, which is a natural filler substance. Our own body produces hyaluronic acid, so people don't get allergic to it. A lot of different HA products on the market. It has to do with how they're prepared chemically, the size of the bead, the molecule.
I don't mean to complain, but when I'm getting a free procedure, I like it to be timely. So can you get the mic back on and let's get going here? I mean, already.
Picky.
Charge them double.
You're like one of my pain in the you know what Beverly Hills patients. So let's just review. I mean, the biggest thing, that's what we want to cut down is right in there. Now, we focus triangle like so. We don't want to get this because what it'll do is drop his brow.
Makes me look like Mr. Spock.
Line in his head.
Which line?
Well, you kind of just traced your finger along it.
These lines?
This one.
Don't touch.
Oh, that line. Were you? Did you do fencing when you were at Heidelberg University?
Don't.
Is this from a pillow?
Would you just?
Listen, you subjected yourself.
Was that a beer can at Arizona State?
More likely, yeah.
So we're gonna cut these lines, frown force. That's it.
He knows how to frown.
Procerus and corrugator. Those big names for those muscles that cause that action. This is the frontalis muscle here that sits like that. When it contracts, it causes wrinkles to form this way.
When they talk, it messes with my procerus and my corrugator.
Big smile. See the crow's feet there. We're going to hit those for him right in there. And then finally, we're going to do some volume, and we're going to fill his nasolabial lines here, and I'm going to add a little bit of volume over his cheekbones. So I'm a nice guy. I'm going to give him numbing cream.
I've never had numbing cream when I've done this,
frosting
so
on
this
the
is
cake.
nice.
So before you didn't have it,
No.
did it hurt?
Yeah, it does a little bit. The filler in the temples has always been weird, and I've only done it a few times, but you actually hear like the cartilage.
Oh yeah, the crunching.
You hear the crunching
over
of
the
cartilage.
lining, over the bone. Yes.
Yeah, so when he actually does the filler in the temples, if Dana and you are quiet for 2 seconds, Adrian, which I realize will be very difficult, the people at home will actually be able to hear the crunching of my cartilage. Which
And do you think they want to hear the crunch?
No, but I think it'll make you happy later on, at least, in playback. You guys can make it your new ringtone.
I felt the crunch just when I had Botox in my forehead once upon a time. Oh, I have, yeah, because these lines, like when I move my head, you see these lines, but also when I rest my face, the lines stay. I swear I've had lines since like a child.
Yeah, sometimes if someone does Botox and they do it and not exactly like there is a science, there's an art to this. And you could look like Mr. Spock. Where this is all,
one is, and you see it. If you look closely on TV, you will see people whose Botox have left their brows cattywampus.
Yeah.
That one brow is down, one brow is up.
I had a bad experience my first time, actually. Someone gave it to me for free. I had a friend who worked at a place, and everyone could bring one person in. So they gave me the whole unit or whatever it was, and my eyebrows fell. So for 6 months, I couldn't even make that face if I wanted to. And being in production, looking at monitors, the production assistants used to make fun of me, and they're like, I can't tell what you're thinking anymore.
You really have to be careful with that. As a rule of thumb,
Get a still shot.
the pupil, the iris, you don't want to, you bring a line straight up. You don't want to inject outside of that because that will drop your brow.
So you will
get
do
that
that on
Dr.
him now,
Ordon
right?
picture.
For fun.
Get one, yeah, for like the teeth.
She wants me to drop your brow. She wants you to really have it. That's the look that she's telling me to do. I mean, you may look more interesting on your podcast, but
Yeah.
all right. So we need to let that sit for a second.
So he's got his needles ready. What tattoo are we doing today, man? Are we just going to do like a Dr. Ordon across my chest or what?
I just want to do a disclaimer that we recently all had COVID testing.
That's true.
Because I would normally have a mask on. I've had my mask on, but for purposes of this,
We did our rapid again just yesterday and twice this week.
Yep.
is this all the light?
You need more light?
Well,
We can get more.
can we?
Yeah.
Need more light?
Yeah, have Max or one of the guys grab some light. You can stay here. Yeah. I would just like to say, get this man as much freaking light as he needs to feel that he can see everything. The word of the day, Dr. O here, is precision, my friend.
Precision. Listen, I have a very picky patient here.
They're getting a light.
I need a needle from my bag.
Oh,
Hold that thought.
Oh, thank God. I thought you were...
Oh, striking. I turned it off. I turned off the light.
Boy, I think I'm gonna see what I'm doing.
I turned off the light beforehand.
Again, this is a slightly lower budget than the doctor's.
That's like a friggin' OR light. I love it.
This is what happens. See, Logan, our director, is actually normally my Uber driver, too.
Thank you.
And,
He's my surgical assistant.
yeah.
So we're using a very concentrated solution. You know, you see this in the newspaper, Craigslist. Oh, discount Botox. You don't want to dilute Botox too much because it's not going to work. So the first area we're going to treat today, frown for me. That's
He's good at
active.
that.
Oh yeah. Sorry, brother. All right. You flinched a little bit. Sorry. You okay?
You're doing great, man.
So we're going to get this whole line, this whole ridge, and I told you that we're not going to go beyond the pupil. We don't want to drop any brows. It's going to be a winner.
It's gonna look great.
No, it really is going to be good. Doing great.
Thank you. Very encouraging.
I want to videotape Adrian's face videotaping.
I should have eaten lunch before this.
All right, I'm really happy with how that went. Let's do some crow's feet action. Low pinch. That's going to make a huge difference. All right, relax. Excellent. We have the ice.
Yes, right here. 3
All right.
packs.
All right, hold that for me. You're the assistant. You okay?
Doing great, bro.
I think the worst is over for you now.
How many
All right,
people
nice.
get to do Botox with Dr. Ordon from the doctors? I mean, that's pretty cool.
That's pretty cool.
I mean,
All right, so the good news is we're using Juvederm Ultra Plus XC, great product, hyaluronic acid. We're going to do a couple things with this for our buddy Drew.
the filler.
And this is filler you see instantaneously. What's cool on this, you actually see this fill immediately. So the good news is with the hyaluronic acid products, there's lidocaine built into it. Okay, we're going to start here. So this is going to numb you as we go. You okay, brother?
Mhm.
Watch this fill right before our eyes. Low sting. You starting to see that already?
Wow.
It's gone.
Really does. That's
Oh, yeah.
amazing.
Full pinch.
You should stop and let us see the one side compared
Yeah,
to
So
the
let's
look-
do
other.
it side by side. Holy smokes.
Is there a difference?
Focus in on those creases.
You want to take a picture of the side by side? Should I look right at you?
Look at moving.
Side, just done with filler. No filler.
Do you move your face kind of because of the lighting? Just do like this movement, yeah. And then back.
Does it show?
Yeah, yeah,
Should.
for sure.
All right, nice. All right.
Then you
So
can get
we're
the-
doing a couple extra special things for the Drewster here. Part of aging, we lose volume. So what I'm going to do is I'm going to enhance his cheekbones. A little pinch. You okay?
Doing great, man. Come on, hundreds of hours of tattoos on this body.
This is a deep injection. You're starting to see how we're getting a little volume in there. See the subtle difference?
Yeah,
Right over the cheekbone,
yeah.
okay?
Volume
And
there.
then he didn't like his temple. He's a little low in here, so we're going to add volume. Right in here, sorry. You okay?
Mm-hmm.
Good.
So much fun.
Now he's a little low in the temple. So we're gonna come in here, little stick, sorry.
I think it's easier to get it than it is to see it.
Right. I never forget that.
Okay.
Mm-hmm.
Look at those leading man cheekbones.
Oh, yeah.
Do you see that? So he's getting a little space lift here. So I'm using a whole syringe on one side. All right, now I'm gonna mold all of this in. I just gave him cheek implants.
What's like the biggest growing categories you're seeing, Doc? That people are emerging categories of plastics.
Really light liposculpting, 3D liposculpting is huge.
What is that versus regular lipo?
Well, it's that you're not just removing pocket fat, you're really trying to form anatomical contours.
Got it. Do you need some help with the light readjustment?
Now, yeah, I can move this.
Let me
that
see
side
your
better.
cheekbone. Oh, that is nice. That is nice. And we got that nasolabial line.
Yep. Should I keep
Okay.
ice on it?
Yep.
Nurse Dana.
We're gonna start on this side.
I'll do it. Don't worry.
Is that okay?
I know you will.
You go ahead. I'll just keep icing myself.
It's gonna make a nice difference. I already see it. Soften that. Sorry. All right. Now we're gonna do the same with the cheekbones. We'll pinch. Get this numb for you. Okay.
All good, baby. I just feel like the years are just melting off.
You're gonna look good. This is deep. I'm putting this in just like a cheek implant. Sometimes we use your own fat, but that involves a whole nother step in harvesting the fat.
Do some people take better or worse to Botox and filler, like their skin? Because I know with tattoos, for real, some people's skin holds ink better, absorbs it better, absorbs it not as well.
Everyone is a little bit different how they respond to this, yeah.
Okay.
We're winding down, we're fine tuning, so molding it in.
Okay. That helps
With
you.
I can feel exactly, all the product is between my fingers there. I'm molding it just like a cheek implant right on
the cheekbones. Let me take a look. That's pretty nice. That's pretty darn nice. You know, he looks like he's been attacked by the bees a little bit. But I mean, we just did a lot. Hold that on there and hold this on your forehead. All right, so, you know, you can't judge the result today. We need to get a picture in a couple days.
Doc, you are a gentleman. You are an extremely talented doctor. And
Well,
again,
you put the pressure on me, the bright lights, the live TV.
and I don't think also we didn't make this point. You're obviously plastics, but you have an incredible medical background, ear, nose, throat. What are all
And
your
general surgery.
Yeah, so
Started with general surgery and then head and neck surgery, which encompasses ear, nose, and throat. And then plastic and reconstructive surgery residency, which encompasses things like cleft lip and palate, burns, hand surgery.
yeah. So Doc is very humble, but he is exceptionally. And where do you you do some teaching as well? Where at?
USC, I'm a full professor at USC.
Yep.
Work with the residents and the fellows.
Yep.
My old alma mater.
Good stuff, man. You are the man. Thank you.
Well, give us a
Appreciate
couple days.
Couple of days, but already I feel youthful. I feel excited. Did you guys have some fun? Who's up next? Come on.
We ran out of juice.
You use up all your juice on me?
Next time, we're going to have a girls' Botox party.
No. So what is my exit? Well, listen, if you enjoyed watching and seeing me get jabbed, poked, prodded, I know Dana and Adrian love when we do episodes that include pain for me.
You look a little like Rocky now. you didn't know it was an episode of Rocky.
And there's that bedside manner again from Dr. Ordon. And so if you have been watching, thank you, subscribe, keep watching, check back, a lot more fun.
This really was fun. I love this format. I love you all. I feel like I'm with family here.
You're going to come back and join us regularly from time to time. We have our own little series with Dr. Ordon coming up called House Calls with Dr. Ordon on various topics. So if you want to hear Dr. Ordon talking about a specific topic, email us. What's our email again? Is it info@asnotseenontv.com. You can go to our website is notseenontv.com. You can find us on YouTube. But any topics in specific that you want to hear Dr. Ordon talk about?
Sorry, I don't want you to laugh. You still have a spotlight on you.
on his face that's been attacked by the killer beast.
And thank you again for, this is As Not Seen on TV. Thank you.
That's a wrap.
And then some.